Hi, everyone. We're just going to give it another minute. Thank you for being with us here today. We're just going to start in a minute. Okay, we'll just give it a few more seconds and we'll get going. Okay. Hi, everyone. Welcome to our first ever Crystal Ball Clinic. This is our healthcare trends and tech game show, though there are no prizes. Maybe we'll have prizes for the next one if we like this one. Basically, we're gonna be putting. If you haven't caught it yet, in January we released our 2024 predictions project, featuring some of the top voices in digital health and tech, Patrick and Sally included. So we're gonna put some of these predictions to the stress test. We're gonna review them. We're gonna put them on the main stage, so to speak, and then we'll just examine them together to learn what they can tell us about the future of healthcare, technology, and the ways in which they intersect in 2024. So without further ado, I'm super excited to introduce our two panelists, Sally Ann Frank, worldwide lead at Microsoft for Startups, and Patrick McGill, EVP, Chief Transformation Officer, Community Health Network. Thank you both so much for taking the time and being here with us. So before we get started, just I want to quickly introduce myself. My name is Gidron, and I am Hyro's head of content and your host today. Hyro is the world's leading responsible AI-powered communications platform for healthcare. I know that's a mouthful, but I'll explain. Hyro's generative AI fueled platform for web, mobile, and call centers stands on three foundational pillars that make it safe for patient facing use. So those pillars are one, explainability. Okay, so if you've been using ChatGPT, Google Gemini, or any other generative AI application, you've probably noticed that there is no way to look under the hood. No way for you to understand what goes on behind the scenes. You can only see the output, but you have no way to investigate the root cause of errors or misleading responses. With Hyro, you can review and examine the exact data sources used to compose every output. Controls, speaking of misleading outputs, if there is one thing you cannot afford in a clinical patient facing setting is hallucinations. Basically, instances in which a conversation will interface incorrectly but convincingly answers a question with a fabricated response. By allowing users to clearly define and restrict data sources and placing strict safeguards in place, we have been able to eliminate hallucinations by 99%. Lastly, compliance. Obviously, solutions that comply with HIPAA and current regulations are great, but what you actually need, especially in such a rapidly evolving space, are solutions that can adapt to developing policies and scale with them. Hyro's adaptive architecture means that we are able to layer the platform with any new requirements introduced by legislators without our customers having to involve themselves with this process. And as you can see from this nice testimonial over here to the side from Intermountain Health's Craig Richardville and the stats, this approach has been highly effective in moving the needle for Hyro customers. So if I was able to pique your curiosity, and just in case you're going to be in LA for Vive 2024, woo, next week, make sure you stop by Hyro's booth number 1810. We've got an arcade game we developed just for Vive, quizzes, prizes, and we'll have back-to-back joint live demos with our partners Salesforce, Artera, Gozio, and Kairos Health. And of course, just get to meet awesome people and have great conversations. Okay, so time to kick off our Crystal Ball Clinic. The rules for the game are very simple. A prediction from one of the healthcare leaders who participated in our 2024 predictions project will pop on screen. I will then ask Sally and Patrick to weigh in on the prediction. Then I will ask you to voice your opinion. We'll have a poll for each prediction to see if you agree, disagree, and the option for you to elaborate in the chat and have a dialogue with Patrick, Sally, and myself. Ready? Let's go. Okay. First prediction. Patrick, you are up. Of course I was going to do this. Okay, so Patrick, your prediction for 2024 was that healthcare leaders must champion enterprise-wide horizontal thinking to transform historically fragmented vertical patient journeys into unified consumer-centric experiences. Leaders who dismantle silos through shared governance, incentives, and patient journey mapping will be best positioned to provide consistent navigational support, user-friendly billing, and value-based care coordination. Those still trapped in outdated vertical thinking will watch customers flee to competitors, offering one-stop personalized service through advanced digital platforms and savvy patient advocates. Now, Patrick, can you expand a little on what you mean by outdated vertical thinking?
Yeah, so I had a feeling you were going to pop one of us on.
Oh, of course.
First, so I appreciate.
I'm going to pop both of you.
Yeah, I appreciate being first to lead off, and thanks for having both of us. This is really exciting. It's a fun format. You know, oftentimes healthcare organizations, health systems are really organized in a vertical way. So if you think about a typical organizational hierarchy, we talk about product lines or service lines. We talk about hospitals. We talk about clinics. But that's not how patients experience us. They experience us more on the horizontal, meaning they come in, they have a need, you know, they have an issue that needs to be addressed, and they're trying to navigate the system. And what we tell them is, oh, you've got to go over here into this vertical. Well, that's controlled, that schedule's controlled over here, or you've got to go to this clinic or office or hospital, that's controlled over here. And I think leveraging technology, the health systems that are able to make this transition from a vertical thinking and organization to a horizontal will really be able to layer in technology, services, processes to really drive that customer consumer experience. And that's really how we experience other things in our life. So if you think about other experiences in your life where you have a great customer experience, when you go to Amazon, for example, it's millions of sellers that are on the platform. But imagine if Amazon was constructed vertically, where you had to go to each seller's website to buy something,
right,
and then to schedule your shipping, and then to schedule your pickup. You know, that's not the way it works with every other aspect of our life. But for some reason, healthcare still thinks that we can operate that way. And I think that's really, we're at this pivot point where technology is really going to enable the breakdown of those silos. Now, Sally can look at me and say, "What an idiot!"
No, Patrick. I think this is great. You know, there are a couple of things that went through my head as you were talking. One is that I have a customer colleague that talks about the fact that, you know, from his perspective, he's a CIO at a large healthcare system. He says, you know, 80% of what we do, probably, I think this is his quote, 80% of what we do is like any Fortune 500 company. It's the 20% of healthcare that we specialize in. And so when you think about this outdated vertical thinking, it's almost like flipping that on its edge and like, well, if we were a Fortune 500 company, how would we be servicing our patients? The other thing that popped into my head is that not only are patients/consumers no longer happy with the healthcare delivery model that we have, but with the incoming clinicians and other people that are coming in from digital native generations, they're not happy working in that kind of environment either. So it's almost like we're at this fulcrum where we are almost at the point where both the consumers and the people providing the services are no longer going to stand for this kind of vertical, outdated mode.
Yeah. Let's see what our audience members think. Do we have the results yet?
Do you want
Oh,
us
here
to
we
vote
go.
too?
Oh, I guess so. I think you already voted. Okay, so they're everyone is pretty unanimous. Um, I was wondering, Sally, from Microsoft's perspective, right? How how is Microsoft such a meaningful player in this field, and ever increasingly meaningful player in this field? How are you planning to bring this future about?
Well, we sit squarely in the productivity and platform area. And so when you think about how we show up for healthcare, we are providing the platforms and the tools that our customers and partners are building upon, like Hyro, to accelerate this transformation from this vertical model that Patrick talked about to more horizontal thinking. So we are much more the enablers of the type of vision that Patrick and others in the industry have, and that's really where we are comfortable. We're never going to be a healthcare company. We like to enable and support the development of better solutions, better workflows for our customers and partners.
Mm-hmm. Okay, great. That's prediction. Sally, you're up. We will continue to see wider adoption of generative AI as the industry improves content moderation and effectively ring fencing the sources, allowing us to add more administrative use cases and advance to clinical applications. I expect this journey to take years, with risk continuing to be a guiding principle determining when and how Gen AI will be used. We will see greater guardrails developed by governments and regulatory bodies, like what we are seeing with the recent European AI blueprint. We will continue to march toward personalized medicine and the use of virtual and augmented reality applications, especially in mental health. Okay, Patrick, two questions for you on Sally's prediction. Number one, do you expect this journey to take years?
Yes. So yes and no. Let me say yes and no. So I love the quote that Sally had around 80% of what we do is like every other Fortune 500 company, because I think that's the 80% of what we do is ripe for disruption with generative AI and technology and just technology improvements. It's that 20% that's specific to healthcare, which I think will take years. And we've got a long way to go from a privacy, from an health equity standpoint. And quite frankly, the medical legal structure has to change. The laws and regulations around medical malpractice has to change in order to support. So what happens when a AI algorithm makes a wrong prediction and that there's a harm to a patient? Who's at fault? And I think that will take years to come to fruition with just sorting that out. However, we really like to use the term assisted AI. And so how do we assist our clinicians to really drive efficiencies, improvement, clinical decision support, other things? But quite frankly, it's that 80%. It's the white space in healthcare that doesn't really involve a provider-patient interaction that is absolutely can be automated and improved. And it goes back to the last prediction. How do we break down those silos and really leverage AI? So it's a both and question. I love the prediction, and I absolutely think that there's a lot of opportunity here that we've never had before, but we've got some challenges, right?
For sure. And then my second question was the use of virtual and augmented reality applications, especially in mental health. Maybe Sally, do you wanna talk about this a little more? What are you envisioning?
Well, I don't have to envision much because it's already come to pass. But we are working with quite a few startups that are focused on virtual and augmented reality applications, some of which are more treatment focused. But in mental health specifically, we're looking at the use of these technologies to manage pain, to manage anxiety, to provide additional modalities for better mental health without over indexing on drugs, frankly. Because if you have episodic issues, or if you have tendencies or sensitivities to certain types of drugs, then having an alternative is really quite wonderful. And one of the things that we're also seeing is, we've got one startup that's in the Microsoft for Startups program that's working on, maternal health, prenatal, postnatal health. And these types of things can be really game changers because they become very personalized, and also an opportunity for people to draw within the strength they have of themselves and not rely on drugs or external therapies, but can manage their own mental health, frankly, armed with these tools. And so I think it's really an incredibly interesting space. And if you've seen the research over the last couple of years, the need for mental health support and services has just skyrocketed. And so these are some additional alternative methods of helping maintain better mental health.
How widespread are these tools, and how available are they to the general public?
They are becoming more and more available. I don't have any numbers per se, but another startup that we're working with, Realized Care, they started with just a headset, but now they have the headset and they also have apps that can help. So you don't have to have the headset. You can have the ubiquitous, medical device of the future now, which is your phone. So I think with the varying form factors, will have greater uptick.
Right. We have a question here from Lacey Nestler. Can you explain, OB nurse here, can you explain the parental postnatal tool? Does it include labor support?
It doesn't at this point. The company is called Vital Start. And if you're interested in learning more, I can definitely put you in touch with the team over there.
Great. Okay. Next prediction.
Somebody else to pick on, I hope.
Oh, we have another. Yeah, exactly. But not one of you. Okay. So this is from Ars Rahim, Senior Director and Digital Transformation Officer at Montefiore Health System. The use of ambient technology to listen into patient-doctor encounters with permission and necessary waivers, of course, will enable us to document, chart, create medical notes far more efficiently and quickly. It will also reduce pajama time and, in some form, physician burnout. The same technology could also be used in more administrative settings to help create meeting minutes, identify action items, and assign them to individuals via native email and project management platforms to ensure more cohesive and efficient collaboration across multiple initiatives. So, Sally, ambient technology, is it here? Has it really arrived? Or will it really arrive in the next 12 months?
So it's here. And as you and some of your attendees may know, Microsoft purchased Nuance, which has a fairly sizable footprint in the industry. And there's been additional movement in integrating Nuance solutions into Epic and all kinds of things. So yes, this is here today, and we have multiple customers using the Nuance tools to do just what your predictor said here. It really is going to be a game changer as we look at the satisfaction of clinicians and the burnout rates and all of that. And this is one of those, generative AI tools, when we were talking earlier about that Patrick, mentioned, some of it's going to be clinical decision support, which is going to take, or maybe autonomous clinical support, which is going to take, much more time. But this is here now. And I think it's going to be a tremendous game changer and hopefully draw more people into the industry because a lot of the drudgery goes away.
Right. But do you feel like adoption, the tools are there, but are they being adopted at such a rate where pajama time will actually be reduced? I feel like there's always sort of this gap between habit and then, really trying out a new technology. Like, I feel like, a PCP with 30 years of experience might be hesitant to start using ambient technology. I might be wrong. Maybe they're just waiting for it. But how do you change practitioners' habits to start adopting technology? How do you help them help themselves? Patrick, any thoughts on that?
Yeah.
So I am a family physician with only 20 years of experience, not 30.
Okay. Not bad,
so,
not bad.
And I am, for the last 4 months, a user of DAX Copilot. So we at our health system are making the transition from virtual live scribes, to putting all of our 1,500 providers on DAX Copilot. I made a comment to someone, so I started using it. Like I said, I see patients 1 day a week. Started using it about 4 months ago, and I'm a very proficient. I came up in my administrative career in the informatics realm, so very proficient EMR user. I know how to use. I've done building. I know how to use the EMR, but there was still something that was missing, and I really try to not be on the keyboard when I'm in the exam room. This has been the one thing in the last 10 years that's absolutely a game changer. So I walk out of clinic every day that I see patients with all of my notes done. And I would argue they're actually better notes. They're more descriptive of what the patient is telling me or we've talked about. And I've even pushed it to the limit. I'm somebody who I love to talk to patients about random and bizarre things and what's going on in their life. And I've even said, I'm going to push this thing to the limit to see if it will weed out all of that nonsense talk that I do in the exam room. And it does. So there's a question about how accurate it is.
Yeah, how accurate is it?
It's incredibly accurate. It does take time. It learns. And so the accuracy continues to improve the more you use it. But it's actually shockingly accurate for all of the back and forth and the jumping around that occurs. So we are excited. I mean, I think that we're aggressively rolling out in primary care. I know that there's things that are coming in specialty care, but this is real. It's here, and I completely agree. It's an absolute game changer. Now we have to figure out how generative AI is going to impact other aspects of the EMR, the in-basket, and some of those things. But this, to answer your question, this is real. So how do you get a 20-year family physician to use it? You show it to them and make it real and let them experience it.
Right.
One of the things I'm keenly aware of is the fact, and having not been a clinician and only a patient, is that, when I talk to startups, I'm always talking to them about making sure that they don't disrupt workflows, that you don't ask a clinician to do something additional to what they are currently doing because it won't get adopted. This is actually taking steps out, which is, nirvana, I think. And Patrick, you probably know better than I whether or not that's true. But yes, taking steps out of a workflow, always appreciated. But don't ask them to continue to add more steps to a workflow. It's not going to be adopted.
The worst thing that's happened to me in the last 4 months is I walked in the exam room and, for whatever reason, thought I hit the button and didn't hit it. It was a very complex patient. I walked out of the room and I looked down to hit the button and I was like, oh man, I didn't hit record. It didn't record anything. So now I've got to recreate all of that. So that's been the most disappointing part of this whole thing, is when user error doesn't start the tool.
Right. How much of that conversation have you retained? Do you feel like it's sort of like GPS in driving, where we have all just given up on our navigational skills for the,
it really allows you to be more conversational, right?
Yeah.
I'm not trying to say, okay, I've got to talk about this or that. I mean, again, I'll go back to my prediction about the vertical and horizontal thinking. This is the same thing. EMRs force you to kind of think vertically because you've got certain things you have to document. But an office visit is horizontal. People are all over the place with how they talk, and they tell about their family and medications and questions and side effects and this and that. This allows you to have that horizontal conversation.
Okay. Well, and the other the other thing about that horizontal conversation is that, you know, we go to, you know, primary care, a specialist for that, a specialist for this, and you know, and all of this, and kind of adding to Patrick's point is that if you mine that conversation, you may be uncovering other problems, other contraindications, whatever, that a conversation about this particular thing, because that's how the EMR works, would not generate.
Right. So safe to say this 2024 is the year of ambient technology, or has it passed, you know, a crucial threshold?
I think it's getting there. I mean, I think that there's still the skeptics. I think there's still things, but I would say 2024 and 2025 are going to be to Sally's point, deeper integration with the EMR, you know, cost and other things. I mean, I think it's getting there. It'll get there.
Okay. That's a big
one. Just for the record, for everybody that's listening, Sally and I have never spoken before this meeting. So
yeah,
this was not a plan that Patrick's using.
They did not match versions. None. Okay. That's a bold prediction, and we're gonna have to check in 2025 and 2026 to see if if ambient technology took off. All right. Next up, we've got Adrian Woods, Director of Digital Engagement at Hackensack Meridian Health. The digital front door will evolve in 2024 to encompass comprehensive wellness services, with patients expecting recognition and rewards for maintaining good health. While not all patients may opt for AI-powered virtual assistants, the expectation is that such technology will be readily available for those who choose to leverage it. For those embracing AI tools, the accompanying app will serve as a multifaceted hub, enabling users to check lab results, manage appointments, communicate with their healthcare providers, and receive personalized care plans based on individualized factors such as genetics, lifestyle, and medical history. What do you think, Sally? Are we there? Is 2024 the year where we really, become one with technology when we get suggested, treatment plans based on our genetics, lifestyle? Where are we on that sort of progress bar to get to a more sort of synergetic combination of human and technology in healthcare?
So the thing that we've learned about these types of wellness tools and all of that is that the people who are super focused on their health adopt these and stick with it, and those that aren't don't. And so, there have been studies about like Apple Watches and other wearables where 3 months after someone gets one, they stop using it, and that's not everybody. I personally would love to see us move from the break fix model to a more holistic wellness model and trying to keep people healthy before they become sick or complications. I think this is going to take a lot longer because it requires a change in behavior of a lot of people. There are statistics that say as much as 80%, and I don't know if that's correct, but as much as 80% of our adult population in the US is pre-diabetic, and that didn't get there by themselves. And I may be off by 10 points, but it doesn't matter. It's not a small number. It's a huge number. So I would say, putting a tool in everyone's hands to do this type of thing would be great. Again, how many people are going to stick with it after 3 months? So
Sure.
I think it's aspirational. I would love to see it happen. It would have a tremendous effect on individuals and population health. I just don't see it happening quickly. Patrick, I'd love your thoughts as the doctor in the house.
Yeah, so I think it's both and. So I think it's more than just wellness services. So it's really the comprehensive medical healthcare treatment services. So I agree with what Sally's saying. A large factor of our health is related to social determinants, and so can these tools impact or help impact or raise awareness on some of those social determinants? Exercise, diet, sleep, those types of things. Absolutely. Now, so I think it's a continuum. I absolutely think that what we were talking about earlier, embracing some of the AI tools to integrate factors such as genetic, lifestyle, medical history into and create a personalized treatment plan. Absolutely. That's available today. We can do that today. Now, the continuum is having the adoption and have people change behaviors and everything else is where the hard change management occurs. So I think it's a both and. I think we can start with creating personalized treatment plans, which may help drive adoption. We've never been really good in the past at creating these personalized treatment plans. It's kind of a one-stop shop. You're diabetic. Here's your list of medications, the algorithm I'm going to run you through, and not really taking into account some of those other things. I think that's where the amount of information that's now contained in the EMRs or on our wearables or in our genetics is now available at the surface, that leveraging AI and technology to create that personalized treatment plan is something that we've really never had in the past. And so I always question, it's a chicken and the egg. Is that what's driving low adoption, or is it another situation? Is
it possible? Yeah, go ahead.
No, I was just going to add that I think this is a use case where generative AI could be really helpful, because one of the things that happens and I like to think that I'm a more keyed in consumer of healthcare services, but when I go to my medical records, I don't know what the heck it says. But if I could have a little generative AI co-pilot type of thing that said, hey, what does my last blood work up really mean? And it could tell me in layman's terms, that would be super helpful, because then I'm armed with information to actually have a conversation with my practitioner in a way that I understand what needs to be done, and maybe adoption of new behaviors would be easier. So I think that when we look at these types of personalized medicine and approaches, educating our patients and ourselves about what this means is really important. And this is a great way to use this technology to kind of break it down into terms that patients can understand and consume and act upon.
So those capabilities are available today. So we're about to go live with a company that uses generative AI to give you a personalized description of what your lab results imaging based on your medical history. So it's designed to obviously educate and empower you. It's also designed to reduce some of the workload on the clinicians, because that chloride of 101 is really insignificant. So you don't need to send a message to ask, why is my chloride 101? And so again, it's a two-way conversation. So it's really designed to give you that personalized information based on you. It's not a canned out of the box, this is what a CBC is that you would get if you went and Googled it. This is what your blood count has been over the last 10 years. And this is why your MCV that's 0.1 above the normal range is not significant.
Okay. I have so many questions on this topic, but we have more predictions. But okay, so we can say in the future, probably not in 2024. Okay, the next prediction is from Dr. Zafar Chowdhury, Senior VP and Chief Digital Officer and CIO at Seattle Children's. In 2024, Gen AI is supposed to make significant strides in healthcare by transforming patient care, drug discovery, and medical imaging. Gen AI tools will enable personalized treatment plans, accelerate drug development timelines, and enhance diagnostic accuracy. Generative AI will continue to accelerate in the field of AI-powered diagnostic tools, leading to earlier and more accurate disease detection. These advancements will revolutionize healthcare, leading to better patient outcomes and reducing costs. Are you, any one of you, Sally, Patrick, are you seeing this in the field? Is Gen AI being harnessed at this point to enhance diagnostic accuracy? Because we sort of spoken about it not being quite ready for clinical use, but in what ways are you experiencing or seeing, Patrick, generative AI really expediting processes?
Yeah, so there's a couple of ways. One is, the real benefit of generative AI over historical natural language processing is the ability to understand context.
Right.
And so I think that's really, when you look at, let's just take imaging reports, right? A radiologist has read an image and there's that information that's in that. We could use NLP to parse out different aspects of that, but it's hard to understand the context. Where Gen AI is taking it to the next level is understanding the context and identifying things that need to be followed up on. So lung nodules are frequently found on incidentally on other, when you have images for other reasons, and they often go missed. And so leveraging Gen AI versus NLP, I think will take that to the next level to enhance that diagnostic. It's not really changing the diagnostic accuracy. It's really it's creating that personalized treatment plan so that things don't fall through.
Right.
Imaging, there's been kind of pros and cons of using AI to actually read the images. And I know there's some studies that support it, some that refute it. I think that's still in a gray area, but using AI as a backstop for radiologists that maybe missed something, or a wet read before a radiologist reads it, I think absolutely is possible. And that's here today. So it just depends on the specific use case and how much do you want to rely on the AI?
Sure. Sally?
Yeah, I mean, obviously, I completely agree with Patrick. On the accelerate drug development and kind of those types of use cases, I am seeing the generative AI try to impact those processes by bringing together what is often, a wide variety and possibly hundreds of thousands of documents that need to be evaluated, and research that needs to be looked at, and how do you bring that all together? So I do think that on the drug development side, it will be a boon. I think it will take a couple of years, because all of this has to be adjudicated as being safe and responsible AI, as you opened up the event with. So I think that's another space to watch on the generative AI side, and this doctor's comment there is well taken.
Okay. So our next prediction is from Mr. Ed Marks, Chief Executive Officer at Marks Advisory. The imperative to enhance efficiency and reduce costs has become increasingly central, and I'm going to skip to the end. Ed Marks believes that 3 key technology implications are at the forefront of driving efficiency in 2024. IT outsourcing, robotic process automation, and AI-driven analytics. Patrick, Sally, IT outsourcing is something that I've been hearing about happening a little more in healthcare. Have you been seeing more of that? And do you think that might be key to reduce costs and operational efficiency?
We have seen more IT outsourcing. I think it's TBD on is that a long-term solution? I think there's still regulatory questions that have to be answered. Certainly there's intellectual property questions that have to be answered with IT outsourcing. There's HIPAA and data security and privacy. I mean, all those questions have to be answered. So again, it kind of goes back to what we were talking about earlier. Are there functions within IT that could be outsourced? Probably. Is
Right.
it, are we ready for wholesale IT outsourcing? I'm not sure. I think of the three that he talks about, probably the AI driven analytics is probably the most promising. You know, we often hear organizations, especially in healthcare, are swimming in data, but lack information. I think that's where AI can really help drive gleaning the insights and information out of the data. That's typically been very difficult and cumbersome for a lot of organizations to do that.
Sally?
Yeah, I agree with Patrick. I think AI-driven analytics is probably the top one here. You know, on the IT outsourcing thing, you know, that is largely a cost-saving measure because you don't have to outright employ these people. So whether or not that actually moves the needle on care, it's more of a financial question versus a care question. RPA, we're seeing that you know, in a variety of areas, both on the pharmaceutical medical device side. Labs do a lot of RPA. I've not seen a lot of that in kind of the payer provider perspective, but I could be just a blind spot for me. But yeah, the AI driven analytics is probably the key thing that not only will it be a big deal in 2024, but it's been a big deal for the last couple of years and will continue to be, especially as AI tools continue to evolve. You know, I think about the fact that when we look at co-pilots and things like that, you know, 10 years ago, 15 years ago, you didn't go online and search for everything. You know, you didn't Google or Bing, you know, who was in that movie? And now it's just a question of we do that every day. Like, how many times a day do we do that? And so I think we're on the cusp of having those types of experience within our healthcare, where it's not, and actually any industry, it's not something we do extra. It's part of how we operate more efficiently.
Amen to that. So hopefully in 2024, I mean, okay. I mean, AI analytics, definitely. IT outsourcing, maybe, and robotic process automation, yes. We have a few more great predictions, but I actually want to open it up to our audience members. So, audience, this is your time to shine. Okay, what are your predictions for 2024? We'd love to hear from you. Any predictions? It's okay, because come on, no one has a prediction? Anything? Okay. Well, I'm glad I asked in advance. I actually sent out an email to people asking for their predictions ahead of the webinar. So here are some. We've got Jessica from CVS Health. Governments under pressure from rising costs and workforce shortages will introduce a basic health AI initiative, providing every citizen with limited access to AI-driven diagnostics and treatment plans. This will be met with concerns over data privacy, algorithmic bias, and potential job displacement in healthcare. Thoughts? Do you think there's there's room for government and regulators to step in and sort of accelerate AI adoption?
I do not think so.
Sally? Ultimately, they are responsible for keeping us safe. So it's hard to manage those two things. I will say that I did meet a person from the FAA. I won't mention his name in case but from the FDA, who is actually working with startups to figure out how to accelerate their regulatory journey within the frameworks that are already established. So I kind of like that. With the idea that, you know, some of these startups are going to bring meaningful, like Hyro, meaningful change into the industry. But yeah, these things are never fast. And there's a role for the government to make sure that we're all safe, but yeah, it's not going to be. They're not going to accelerate things. They're going to put the brakes on them, as perhaps they should sometimes.
Yeah, I agree. I think the role of the government is to create the framework,
Right.
But not necessarily regulate the adoption.
So we just got sort of on this topic. We got a prediction from Christopher Walden. Lack of AI governance will be what delays healthcare from adopting AI. Thoughts? Where do we stand currently on AI governance? Because we did have Biden's AI Act. We have the European AI Act. I mean, I feel like there has been certainly movement in the space, but too little, too late, or what do you think? Where do we stand in terms of AI governance?
No, I think it's where people are playing right now, and it's in the non-clinically facing use cases is where you see heavy adoption. And so, I think that's where, before you see wholesale overhaul of healthcare based on AI, I think that's going to take some time. But in some of these more administrative, again, it's running your business. And so how can you run your business with AI just like every other industry in the world does?
Yeah, John Halamka over at Mayo Clinic Platform always talks about, not always, but has spoken several times about the fact that adoption of AI in healthcare is risk driven. So you start with the least risk scenarios, and that's how you apply AI. And as we, continue to do content moderation and put guardrails up, then we can kind of inch our way toward riskier, and I don't mean to say it that way, but higher risk uses of AI where the risk is ameliorated, but that it's more than just an administrative. So you think about clinical decision support, where it is giving you some information for care and treatment, but it's validated by the clinician. And so you're never doing this kind of purely autonomous kind of diagnosis and treatment, but you are giving recommendations or you're providing additional insights that would take the clinician longer to do on their own. And then the other key to this, and this falls under the responsible AI, is all of that has to be explainable. It has to be transparent, so that it's not this black box. It's like, well, here you go. And it's like, no, I need to understand where the data came from and what the algorithm did to come up with this finding.
Nice. I see the predictions are flowing through. Thank you for stepping up to the plate. Aditya Tandel, I hope I pronounced that right. I think realistically AI would have a larger influence to reduce admin burdens for clinicians and hospital staff than for clinical use cases directly impacting patient care. Thoughts? I think we discussed it. Is it? I mean, so we talked about ambient technology, but are you like Patrick from a PCP perspective? Is it cutting administrative emails, everything, all the after hour work that practitioners love so much? Is that actually happening, or is it something, or is it like a talking point that is mostly?
No, so it's cutting down on the amount of time after clinic that you have to do your notes, but I think that's just only one piece of the puzzle, right? We've got to dig deeper into some of these other administrative tasks, like I think Rachel talks about them in chat around scheduling and prior auth and billing and those types of things that still take time from clinicians and the staff. I think that's the other thing. It's not just about the physicians and APPs. It's how do we automate and augment the staff work too, that we're all dealing with staffing shortages, et cetera.
Right. Then we had Lacey Nestler. More rural healthcare facilities will be able to take advantage of AI tools. Has AI made it to rural America? Is it has the sort of distribution of AI tools and call it AI powered digital transformation, has it been even in like more rural healthcare systems?
I mean, I think so. Again, I think it's the use case, right? It depends on how large the health system is. There still is a
Mm-hmm.
cost to adopt these tools, and you often have the cost is the ROI is realized on cost reduction, not necessarily sometimes revenue generation. But so, I think it depends on what the use case is. Certainly, AI in the rev cycle space has been around for quite some time, and so yes, for rural health facilities, when you start to talk about segmentation, social determinants, some of those types of things, absolutely, I think that there's the opportunity in the rural spaces, assuming that when you get to the patient facing, there's always the questions on Wi-Fi and bandwidth and et cetera. But
Right.
from a healthcare delivery, yeah, I think so. And you see the cost coming way down on a lot of these solutions.
And I think
Okay.
a couple of the other trends that you mentioned before about outsourcing IT,
Yeah.
that's where probably that's a great place to outsource. The other thing is with the advent of cloud computing,
Mm-hmm.
it's really helped some of these rural locations where they couldn't stand up their own IT shop. So, their server farms or whatever. So, cloud IT outsourcing, I think, are probably two staples for rural health systems. But to Patrick's point, it's very different to have a rural hospital that's connected versus a rural patient who, may
Right.
have to travel 2 hours to a practitioner when, RPM would be really helpful, but yet they don't have the infrastructure there to support that. So still
Right.
lots of work to be done there.
Okay. We could probably, I have 5 more predictions. But I think, yeah, we're actually running over. So I obviously thank you so much, Sally and Patrick, for sharing your insights with us and your time with us. For those who missed our predictions project, you can find all of the predictions, Patrick and Sally's predictions, and everyone else you saw today at hyro.ai /predictions. And that's it. We'll just need to reconvene in exactly 12 months from now to see how much of these we got right. Sally, Patrick, thanks so much. This was so much fun. And yeah, let's have a great 2024.
Great.
Thank you.
Thank you. Thank
Thanks,
you for
everyone.
having me.